Is it time to change the vaccination protocol to deal with the new reality, moving away from an age-based protocol to an essential frontline workers, people like grocery store clerks? Should they get the jab? What about teachers? Should they be a priority? Let's bring in Jerry Dias. He is the president of Unifor, the largest private sector union in the country. Jerry, first of all, happy Easter Monday to you and your loved ones. What's your sense, given the variants, given the surges, about people in factories, people in teachers, people working in grocery stores? Do we need to shift to put them on the vaccine priority list?
Absolutely. We're sending workers to slaughter. Let's be straightforward and call it what it is. We're saying to the workers, you're essential. We need you. We're depending on you. We're depending on you to show up every day. So we're moving forward on the healthcare workers, but grocery store workers every single day showing up for work, transit drivers, teachers, police, fire. I can walk through the list. If we're sending them to work each and every day, then look, we better protect them. And I think that's fair. My father's 91 years old, Evan. He's had his shots, and I'm happy about that. But is he exposed? No. Is he spending his time in the house? Yes. So look, we need to control this. We need to find a way to get our hands around this. And the only way we're going to do it is we're going to have to go to the people who are the most vulnerable and the most vulnerable at spreading. That's why I think we need to take it a step farther. I think we need to go to the workplaces. I think we need to go to the workplaces and start to vaccine workers that are in close contact with each other each and every day. We have to be more aggressive than we are. And frankly, I think governments are failing dramatically in this regard.
Okay, hang on, Jerry. I want to bring in Dr. Amit Arya, the palliative care physician who's joining us now. Doc, thanks for your frontline work. Most provinces have kept schools open during the third wave. There's lots of talk about moving away from the age-based protocols because we've now protected people like, my parents or Jerry's parents, people who are in long-term care homes. They've got the vaccine. Given the third wave, given where ICUs, the age range is falling, should teachers and other frontline workers, as Jerry Dias is talking about, should we move to a protocol where they are vaccinated first now?
Yeah, absolutely. I can share with you working on the front lines of COVID-19 through this pandemic and working in Peel region in Ontario, where so many essential workers live and work. Really everyone that I'm seeing coming into the hospital who's suffering and dying from COVID-19 is someone who's an essential worker or their family member. And in my eyes, this is all preventable suffering. We have these vaccines in the freezers and we need to get them into the right arms and we need to have paid sick days, but this is all preventable and it should not be happening.
Okay, so you would make the shift right now? Because I just want to remind people, and Doc, you can weigh in on this. This week, Canada's going to get 2.2 million doses of the vaccine, 1 million of Pfizer, over 800,000 of Moderna, 316,000 of AstraZeneca from the COVAX facility. You think we've got to take that amount of dose and prioritize these frontline workers?
Oh, yeah. Absolutely. And I can share with everyone who's watching that it was actually in the end of February where the Ontario government's own science advisory table said that, well, we know that it's not just age, but it's actually the postal code in which you live in. It's the neighborhood in which you live in. And the highest risk neighborhoods are those neighborhoods where you have more essential workers. There's recent data that shows that the growth rate of the variants is almost 3 times higher in the neighborhoods where essential workers live. So, if you have these fires that are raging in specific areas of the province, that's where you take the fire trucks. And that's how you get the pandemic under control quickly. And I wanted to add that, of course, vaccination is one part of this, where, we need to make this a 24/7 operation, get speed and precision, get the vaccines in the right arms. But vaccination won't protect us today. What will protect us today is making sure that we have paid sick days, we have rapid testing, and we have N95 masks in these high-risk workplaces.
Yeah, Jerry Dias, weigh in on that because you got the Toronto Mayor John Tory calling for the Ontario and the federal government to work together to implement paid sick days for essential workers. Your thought on that?
Well, there's no question it has to be. One of the first things that the Doug Ford government did was it repealed Bill 148, which included 2 sick days. So it's almost now as if, admitting that they made a mistake is a harder pill to swallow than doing what's right. So there's a real lack of courage happening right now because to send people to work when they are sick Look, people are going to go to work because they can't afford not to. I think the Peel study laid it all out, Evan. Over 8,000 people tested positive. 2,000 people continued to go to work with symptoms. 80 people went to work after they had the test was 100% positive. So why? Because of a lack of pay. We know today that about 58% of all workers have paid sick days from work. We know that workers $25,000 a year and less, there's only about 30% of them. So they continue to go to work because they have to make a decision about putting food on their plate. And I think the death of the 40-year-old woman the other day, and Dr. Warner, to his credit, is speaking so incredibly important about her. Her husband was told, there's not an outbreak on your shift. If you don't come to work, you're not going to get paid. He went to work. His wife has now passed away. His daughter is sick. No rhyme or reason for this. It takes courage. They have to do it now.
Jerry, that story is so tragic. Dr. Arya, I want to go back to you. The other factor here, I don't think we're paying nearly enough attention to, is why there is so much vaccine hesitancy. There are people who are actually allowed to get it, encouraged to get it, and you've got political leaders saying they're not coming. What is driving the vaccine hesitancy?
Well, I think there's several factors related to this, and I wanted to talk about paid sick days again. I mean, if you don't have paid time off to go and get the vaccine, and as Jerry has outlined, if you're living paycheck to paycheck, well, that's going to be framed as vaccine hesitant, when really it's not hesitancy. It's a barrier in the system that's preventing you from getting the vaccine. And I can share with you data that shows that 65% of essential workers actually have vaccine hesitancy, and I'm using that term in quotes because it's not real hesitancy in my opinion, it's a barrier, but 65% of essential workers are not going to go and get this vaccine because they're worried about losing money and losing their salary, and this would improve by 30% if we had paid sick days. So that's number one. I'm also seeing a lot of focus on these mass vaccine clinics, and they really favor people who speak English, who have internet and a phone and have time off work to go and book an appointment or someone to take them. And really, that can't be happening in these sort of high-risk neighborhoods. I absolutely agree with what Jerry was saying, where we need to get the vaccine to these high-risk neighborhoods, these high-risk postal codes, get it into the workplaces, the factories, distribution, the distribution centers. And that's one way that we're going to sort of at least have some light at the end of the tunnel at this point in time in the third wave, when we have ICU admissions hitting records day after day.
Yeah, the persuasive arguments. Dr. Arya, palliative care physician, I really appreciate you joining us. Jerry Dias, president of Unifor, also really good to have your perspective on this. Thanks, gentlemen. I appreciate it.
Pleasure's mine. Thank you.